Hi, everyone. Can you hear me okay? Great. So my name is Justine Wardle, and I completed my MPH practicum placement at the BC Ministry of Health here in Victoria. My placement was situated within the Population and Public Health Division, and today I'll be sharing the results of an environmental scan that I conducted as part of a larger project for the ministry. In case I run out of time, I'd like to acknowledge the people who helped supported my practicum, including my supervisor, Christy Docking, Dr. Racy, the Office of the Provincial Dietitian, and the Healthy Living and Health Promotion Branch at the Ministry. So settings, the BC's guiding framework for public health identifies settings as an important approach in terms of public health interventions, and schools are one important setting that we focus on. Among children and youth, schools are an important setting for many reasons, including that children spend up to half of their waking hours at school during the day, and schools reach children across social, cultural, and ethnic groups. As well, schools are a place where children develop life skills which support optimal health, emotional, and intellectual growth. Evidence shows that healthier children are better learners and vice versa. In addition, children consume about 1/3 of their total dietary intake during the school day, so the food environment within the school setting has the potential to influence overall healthy eating behaviors and overall well-being. To improve the food environment within schools and to support healthy eating within this age group, some jurisdictions have adopted school food policies. School food policies refer to any policy that defines the food and beverages that can be sold or provided to students within the school environment. These policies can include a range of different policy instruments, such as food and beverage guidelines or school meal standards, depending on the context. And policies may either be mandatory or voluntary, depending on the type. Research has demonstrated that school food policies can have several different effects on the school food environment. For example, evidence has shown that they can increase the sale, availability, and consumption of healthier choices, while reducing consumption of unhealthy choices as well. So the purpose of my project was to conduct an environmental scan of current policies across Canada as well as in other countries. And the findings from the scan were intended to inform recommendations for the province's existing school food policy called the Guidelines for School Food and Beverage Sales in BC Schools, which was developed in 2013. So the first stage of my project was to conduct an environmental scan, which consisted of 3 stages. The first stage was an online scan of policy documents in select jurisdictions in Canada and other countries. Documents were identified through an online search of governmental websites such as Ministries of Education and Health. I then conducted a literature scan in order to identify other jurisdictions that had potentially had policies as well. And then I conducted a second repeat online scan to find those documents were available. The last step of my project was then to complete an analysis of the policy documents. So I compared each policy for a number of certain criteria, including the policy type, the scope, the type of setting, the types of standards and guidelines that it included as well. To be included in the scan, policy documents had to meet several criteria. Firstly, the policy had to be a current policy, had to be published online and accessible via a public website. I selected only the predominant policy in each jurisdiction, whether that was a national policy, provincial, state, or territorial, and in some cases, school board. As well, the policy had to be published in English or French. In total, I found 26 policies from Canadian and international jurisdictions. In Canada, I found 13 policies, 9 of which were provincial or territorial, 4 school board policies, but no national policy. In other countries, I found 13 additional policies, 9 national policies from Australia, England, Northern Ireland, Philippines, Sweden, the USA, Scotland, and Wales, and then 4 state or territorial policies, all of which were located within Australia. So overall, a wide variety of approaches were found across jurisdictions. Policies varied in a number of different ways, including the type of policy, the scope, the setting, and the types of standards or guidelines in which they included. For example, some of the policies addressed food and beverages sold only to students, for example, in cafeterias or vending machines, while others extended to also foods served through free school meal programs, snack programs, and classroom activities. In other cases, policies also applied to foods provided to parents, teachers, and other people within the school environment. There was also a lot of variation in terms of the types of guidelines and standards that the policies included. For example, some focused narrowly just on what types of foods and beverages could be served, while others also looked at other aspects such as food safety, curriculum, and connections to other healthy schools programs. Each school food policy document reflected the differences in the policy context, such as the educational system, the presence of school meal programs, and so forth. However, there was a lot of similarities as well between the policy documents, which was interesting. In particular, many of the policies employed nutrient-based standards to define the types of foods that could be sold within the school environment. In general, the policies all restricted foods that were higher in calories, sodium, salt, and fats, whereas they encouraged foods that were higher in fiber, protein, and micronutrients. This is generally consistent with a public health message in developed countries where overnutrition is a greater concern for diet-related diseases. The majority of policies also used a traffic light system, where foods that were generally more nutritious were encouraged with a green light, whereas foods that were higher in nutrients, such as sodium and fat, were restricted or limited as well. And despite that many of the policies were mandatory in their jurisdictions, I found that many of them actually provided very little information about enforcement or monitoring processes. This is consistent with the literature, which shows that there's a general lack of monitoring and compliance as well for school food policies. Lastly, the majority of policies also provided standards or guidelines for the school food environment, such as the physical spaces where students can eat, the adequate time to eat, and food safety. However, these varied greatly. So overall, the findings of the scan suggest that there's no single approach to school food policy at the current time. Jurisdictions have really adopted different approaches depending on the context. In order to improve policy, I made some suggestions in terms of ways that they can be strengthened. Many of the policies provided some guidance in terms of the school food environment. In the Canadian context, perhaps providing greater guidance in terms of other areas of the school food environment, such as marketing within the school, would be appropriate, considering that these are current gaps within policy at this time. As well, many of the policies alluded to aligning with comprehensive school health or health, sort of broad approaches to health promotion, which would potentially be a good way to improve policy as well. It's important to note some of the limitations of the environmental scan. Firstly, it was a very small scan with only 26 policies. I was able to only look at policies in English or French, as well as policies in more developed countries. However, from the literature, I know that other countries have developed policies of their own. For that reason, we really can't generalize the findings at this time. So to conclude, a range of different approaches currently exist in Canada in terms of school food policy, but more research is really needed to look at the variety of approaches that currently exist and to evaluate them as well to determine the best approach at this time. However, I found that comparing approaches was a really good way to potentially identify best practice in terms of policy development as well. And again, I'd like to thank my supervisor, Christy Docking, Dr. Racy, the Office of the Provincial Dietitian, and the Population Public Health Division for their support during my practicum. Thank you very much.
Thank you very much, Justine. Any questions for Justine?
Thank you, Justine. I enjoyed reading your paper. And one of the questions, I guess the question I have concerns, you had mentioned early in your presentation about the lack of evaluation and monitoring. And it seems to me that there's another point of intersection that I'd like to just ask you about, and that is coordination between ministries. So, for example, the Ministry of Health has certain kinds of guidelines of what they would like to affect, but it's happening in the arena of the Ministry of Education. Right. And so I just would be interested in your comments about the ways in which policies join up or fail to in the face of that lack of follow-through monitoring and evaluation.
Yeah, that's a good point. Here in Canada, the policies that have been developed in each province have actually, the guidelines were established by a national working group of representatives from each province. However, they do vary, and how their approach to monitoring definitely varies as well. In BC, the policy itself is a policy of the Ministry of Education, but it was developed by the Ministry of Health. So that's always, and they work together to develop that policy. But that's definitely a challenge in terms of ensuring that the policy is enforced, that there's compliance in that region. And I saw that across countries as well, in other areas as well, that there's this potential there's the opportunity to improve policy, potentially by working together, engaging stakeholders in the development, as well as the ongoing enforcement and monitoring.
Any other questions?
Hi, great presentation. My question was, you've now done an environmental scan. What do you think the next step would be? Or what would you like to do as sort of a next piece to sort of work towards updating the policy?
Well, the ministry will be using the findings from my scan and the recommendations that I developed in order to consider its own policy and the future for that, which is a great step. From my own interest as a dietitian and having worked in public health, my desire, I guess, would be like a universal school meal program and using that to really improve school health, having every child have access to a national lunch program and food. But I think along Dr. Hayes as well, sort of that coordination potentially to improve and maybe make national recommendations as well.
Great presentation. I was just wondering if you got a chance to look at the Farm to School initiative from the Public Health Association of British Columbia that's being implemented. So they are focusing a lot of their programming on like sustainable practices and practical application within the schools. So I was wondering if you see that like in the future kind of building into the policy. So, you know, building into the curriculum, local sustainable farming practices and actually getting children involved in the process of their food as well.
Yeah, I'm familiar with that program, and I think it's a great, it's had really great success so far. There's definitely, when I looked at some of the policies, they made mention of food literacy as a really important thing to weave into the policy as well, to bring not just what foods are served, but how food is presented, what children learn about food. The relationship with food is really important, and many of them made suggestions about curriculum, how to integrate the policy in terms of gardening, other school food programs. And however, in general, it was a very vague sort of description of how that was done. So it really up to the jurisdiction, the school board, to determine what and how that sort of plays out, I guess. Yeah.
Excellent. Thank you very much, Justine.